Mark Holthouse, honored that you're here. This is a second installment, if you will, of a two-part talk on how to maintain lean muscle mass pre, peri, postmenopausally, managing body composition, and managing blood sugar, some of the metabolic diseases that are involved with hormone changes. Um, I think that I got excited about this topic because I never had the equivalent discussion really with females, with you all, that we had with men, with what testosterone does for guys, as far as can pulling them away from the cliff of prediabetes and diabetes. It's amazing what it can do for stimulating lean muscle mass and helping control blood sugar with them. The data, though, was always really unclear in women as to what is testosterone doing in a female body, premenopause, peri, or postmenopausal. There's a lot of you all that are taking testosterone cream or pellets for libido, for energy, for all kinds of reasons. And we have kind of a deficit in the literature up until more recently about what is that really doing to women. We know that women that naturally have high levels of testosterone have more type 2 diabetes, more prediabetes issues. What we don't know is why, when we look at the literature on folks that have gotten testosterone, women, as a replacement, we don't necessarily see the same thing. So it's hard to extrapolate the data on women that are naturally high in T as to what's going to happen to them when we give them testosterone as a supplement. Does that make sense? That's a convoluted way of saying we just didn't know for sure what it does. Um, so that's regarding testosterone. Tonight, we're going to talk primarily about what estrogen does. And being that it's the part two of this thing, I'm going to spend a little bit of time recapping because that was back in July. But I hardly remember what I said. So I had to actually rewatch my own. That was torture, by the way. I had to rewatch my own part one to make sure I didn't just say the same thing. But bottom line, what we did is, let me see if this is going to work. My little advancer thing. Oh, there we go. That's a really busy slide. I apologize. And I'm just going to make this really easy. What we want to talk about tonight is how to fuel. And it's part of this whole discussion because as women enter peri and postmenopause and estrogen levels fall, it's so much more than just losing vaginal lubrication. It's so much more than losing libido. It's so much more than just having hot flashes and night sweats. It's even more than losing bone loss and collagen and finding that your hair and your skin and your nails are changing. It's about losing lean muscle mass and about losing control of your blood sugar, which ultimately is associated with lipid problems. So it's no wonder when you guys go through menopause, you catch up to men on your incidence of heart attacks. Before that time, you're protected. And then you go through this change and you come out with more cardiovascular risk. So the idea is, as kind of an overarching theme of tonight's talk, as you lose estrogen, as you age and lose growth hormone, which slowly decreases by about 10% every decade after age 35, you're losing two of the most valuable hormones that promote lean muscle mass, bone density, and glucose control, to say nothing of what it does for things, all the other things we talk about. Testosterone's involved with that as well, but the testosterone decline in women is much more gradual. It's variable, but there are 90-year-olds who have kick butt testosterone in my clinic. So you can't just say all women are low in T by the time they're a given age. It seems to be more stable than it is in men, where there's a predictable 2 to 3% decline every year after about age 25. So there's these three hormones. If you count growth hormone, you look at estrogen, and you look at testosterone, all of which in your bodies are changing as you go through your life and as you go through your month cyclically, how your body is handling lean muscle mass, strength of contraction, and glucose control, insulin signaling. So not only is it changing over the course of your life, pre, peri, and postmenopausally, it changes between the first half of your cycle and the last half when you're still doing those things. As you stop and the ovaries go on permanent strike and you're postmenopausal, you enter this time of permanent, really loss of most estrogen. There's a little bit that's made still by the adrenal gland. There's a little bit of testosterone that's still made by the ovary long after menopause. And there's some that's made by the adrenal. Progesterone, for the most part's gone. So unless you're supplementing, it's not much of that around at all. So the reason we talk about fueling and protein and weight training, resistance training, is that these are the things that now have been studied to replace what all of those hormones that are declining did for you. Is it okay to do both? Sure, but not everybody wants to do bioidentical hormone replacement therapy once they go through the change. The gal that I really respect a lot, that I attended, really lit this fire for me. Stacy Sims, she's an exercise physiologist. She's not a clinician. She can't write hormone prescriptions. So she's coming at this from, what can I do with my exercise phys patients to help with preventing diabetes, cholesterol problems, heart disease, and losing bone and glucose control? Well, we can talk about lifting heavy stuff a couple times a week, and we can talk about fueling with the right amount of protein. And we're going to get into the conversation a little bit about keto, time restricted, intermittent. We're not going to go crazy, but I want to give you some salient points because it's so confusing. If you watch these podcasts and these summits and these webinars, I know because I watch a lot of them, it's like everyone has a different opinion. So I want to give you enough understanding of the background of this discussion so you can reason through on your own what makes the most sense. As far as fueling, I wanted to talk a little bit about protein and carbohydrates specifically. Now, I'm treating women that are active. Full disclosure, I'm not necessarily one that's probably going to be the right fit in guidelines on how to get through peri and postmenopause if they're sedentary and they're unwilling to do any kind of activity. I'm probably not your guy. I'm just going to assume and put it out there. Most of my patients are wanting to use therapeutic lifestyle, meaning whole foods and exercise and managing their stress as foundational aspects to their longevity. That's just out there. So if I have somebody that says, I just want something so I don't have to move or do anything, there's a lot of really great practitioners in the Valley now that are peddling hormones and things, drive-by clinics. That's their business model, and you'd probably be better served there. I'm looking for the kids that when they were 7 drove their mothers crazy asking why. Those are the patients I like to work with. So if some of you in here resonate with that, you're in the right place. So we're going to talk a little bit about protein and carbs, and these are for active women. Branched chain amino acid formulas are kind of what rocks, right? Because there's essential amino acids out there. There's like 9 of them of the 20 amino acids that make protein. And there's 3 that are called branched chains: isoleucine, leucine, and valine. Leucine is kind of the king of the 3 because it is known to stimulate signaling of skeletal muscle mass and developing and maintaining your muscle mass. So when I say branched chain amino acids, it's not that I don't want you doing a complete protein with all the essentials. It's just that these we tend to focus on because women in particular are way low on what they're getting. The current guidelines are talking about 0.8 grams per kilo of ideal body weight, which for an active female doesn't get anywhere near what they need physiologically. In fact, we think it's probably closer to something like 1.8 to 2.3 grams per kilogram of ideal body weight. That ends up being somewhere about 1 gram of protein per pound. So if I have somebody who's 5'5", 130 pounds, that's really close to ideal body weight. In fact, it is. I'm looking at 130 grams a day for protein goal. And the next thing that happens is I get a portal message from them saying, oh my goodness, you didn't tell me how hard that was going to be to attain. I have to eat liverwurst and beef tongue and whatever. I have to eat organ meats 4 meals a day to get even close. And a lot of people are kind of grossed out by that, and they don't want to do that. So enter supplementation. So we have plant-based, high-quality products now, some of which I'm going to talk about, that have the right ratios of branched-chain amino acids and essential amino acids in them. I personally have to supplement to get close to the 180, 190 grams a day that I'm supposed to ingest. So this is a real wake-up call. It ends up being about 30 grams per meal, okay? It ends up being somewhere around 30 grams post-workout in the form of a powder or whatever kind of protein supplementation shake or tablets that you want to use. There's many options out there. And that'll get you there. That gets you into that 120 range pretty quickly. Whole foods, your meals, usually 3 meals a day. Breakfast is now shown to be the most important meal, especially for women, especially for active women, and stopping eating after dinner. So when we say time restricted eating, we're talking about eating breakfast and then quitting after about 7:30 at night, not snacking. So that's protein. We know that when women are in the luteal phase, the last half of their cycle, their protein needs go up by about 15%. And that's because of the fact that as estrogen's dropping from that early follicular phase, progesterone, which is catabolic, is rising in the second half of the cycle. The ability to burn fats versus carb sparing, that switches. So you're like another person the last half of your cycle. And I don't just mean about tolerance for noise and he's chewing so loud, I want to strangle him. I'm not talking about that kind of new person. I'm talking about physiologically, how you deal with muscle mass, how you handle glucose, how your insulin is signaling, how you burn fats changes. And it also changes when hormones change at age 50. So you have this thing before every month, first 2 weeks are this way, last 2 are this way. Then when you hit menopause, it happens and it's more of a permanent trajectory. So we also have carbohydrate requirements where we're talking about fueling around exercise. This is the motif tonight. Fueling around exercise, protein after to recover, getting some carbs in pre. So a lot of people will say, well, what do you mean by carbs? Well, it's clean, organic greens. It's complex carbs. For the sake of sounding too commercial, I'm just going to say Athletic Greens as an example, AG1. This is one that's out there. It's a very popular product. There are so many different greens drinks out there that are organic, that are clean. But this is the kind of carbohydrate that I'm talking about. What's novel is that there's really no business for very low carbohydrate diets with active women. If you do the math and look at what they require, an hour a day of working out, they recommend around 5 to 7 grams per kilo of ideal body weight. You do the math on that, that's a lot more than 75 or 150 grams of carbs a day. So this is not a keto diet by any stretch. Now you're getting these from complex carbohydrates. These are not from, a Starbucks, whatever pastry or I'll pick on someone else, a McDonald's croissant or whatever they have over there. This is real food. This is complex carbs. This is from plants. It's veggies. It's some of the lower glycemic fruits and things like that. So you need to be fueling pre-exercise. I usually recommend giving a little bit of creatine. Yes, for women, creatine's got great data. It doesn't do everything that it does good that it does for men, but does enough to where I recommend it. It's not unsafe for your kidney. This is a myth that I want to bust right now. If you've got kidney failure, too much protein, creatine in general, there are things that we have to really watch and limit along with potassium and some other things. So I'm not speaking to my renal failure patients. I'm talking to y'all here. So if you have a known kidney problem, you need to talk to your doc about specific recommendations. But for people that have normal liver, normal kidney function, these numbers are where we want to be. So I pre-workout with creatine powder, usually about 5 grams, mix it with some water, and I mix it in with that AG1 with your carbs. And that's a great way to kind of get started pre-workout to fuel your workout. The 5 to 7 grams per kilo of ideal body weight, that's a daily recommendation for carbs. That's not pre-workout, just to be sure that you guys see that. So if you don't exercise, the baseline carb requirement is somewhere between 3 to 5 grams per kilo. So even that is not a low or a very low carbohydrate program. These are going to help people avoid something we call low energy availability, which we're going to talk about later in the talk, that can lead to just feeling really crappy when you're exercising if you're not fueling appropriately. So there you have it. Protein, carbs, a little bit of creatine, and we're going to talk more about creatine as we come up here. So that's a little bit about fueling. Let's talk about the right kind of exercise. What I'm talking about, again, is exercise that helps the brain, the heart, blood sugar, bone, and body composition. So, I'm talking about bone, muscle, fat. There's really only three things you need to remember on this slide. There's three types of exercise. One is cardio, which we've all heard. The second one is resistance training, which we've all heard. We may or may not have experience with that. My mission is to get women doing resistance training because that's the bottom line, what's really going to help take over as estrogen declines, as growth hormone declines, as testosterone slowly declines. Resistance training is awesome. But it's not just resistance training. I'm from the era where jazzercise and aerobics was a big deal. My mom taught jazzercise for years. Now nobody wants to do aerobics. They say it's a waste of time. We're just going to pump iron. We're just going to lift. So the pendulum is certainly swung the other way. We know that all of these forms of exercise are important, and you're going to know why here after a couple more slides. The third one you might not be as familiar with, and that's called plyometrics. Plyometrics is associated with strength and power, with multi-directional types of exercise. So lunges, that's a plyometric exercise. Box jumps, where you put a box and you kind of jump up and down the thing. Skip hopping, where you skip and you hop. It looks kind of funny for guys to do it, but I do it when no one's looking. Doing push-ups, where between the push-ups, you do the clap and then you go down. So it's very hard. Those are things that can build specific types of neuromuscular adaptations that we're looking for. It's great. A lot of these things are great for the brain, the heart, the blood pressure, obviously body composition, blood sugar. So let's dive into the meat of this a little bit. So what about cardio? It's not slogging away on a stair stepper. It may not even be Orange Theory. It may not even be some of the other kind of CrossFit / aerobic gyms in town. And this really bothered me as a spin bike guy, because I'm all about the cardio. Now, we do a little bit of HIIT and sprint intensity stuff in some of those things. It just tends to be a little bit longer duration. So if you've got a lot of time to kill and you want to do spin several days a week, knock yourself out. I come from that background. I'm really trying to give resistance training a fair shake for the first time in my life. So I tend to spend more time there than on cardio. But when you do cardio, it's not the stair stepper. It's not the 45 minutes holding onto the handles of the treadmill. It's not the Nordic track. It's high intensity interval training. And this is the stuff that helps your heart and your brain in particular. So what is that? It's 80% of your max heart rate, which we're going to tell you how to calculate there on the bottom, because it's not 220 minus your age anymore. That's the old formula, which is like really inaccurate. So if you want to be cool, this is called the Hunt formula, HUNT. It's 211 minus 65% of your age. That should say age, not weight. That's a typo, sorry. So 65% of your age, and it's 211 minus that number. That's how you calculate your max heart rate. And you need to be able to do that to know how to do HIIT and sit. Submaximal, so it's not 100% of your max heart rate. It's about 80% of this number that you get here. That's where we want you to be at HIT. These are only 1 minute long. These are affectionately, some people used to call them Tabata drills. Actually, sprint intensity is more accurate, a Tabata drill, and I'll tell you that next. So you go at 80% your max heart rate for about a minute or less, and then you rest for a minute or two till you're recovered. And you repeat that cycle 6 times. Some people do 5, some people do 8. You might do that once or twice a week. This is not an everyday thing. I have some wonderful CrossFit patients who will do these kinds of intensities every day. And that is why they're always here injured, because they're not recovering. You can't do this kind of efforts without recovery. I don't care how much testosterone you're on. So that's HIT 1 or 2 times a week. This is not something that should take more than 20, 30 minutes. Also, once or twice a week is the sprint intensity. This is most helpful for controlling blood sugar and body fat, belly fat, and lean muscle. These are alternating short periods of intense aerobic, all-out effort, maybe 15 to 30 seconds or less. And you rest as long as you need to be able to go all at it again the next round. You might do this 6 times, and you do that once or twice a week. That's it. This is not a 5-minute interval. It's a short, sharp anaerobic burst. It's a sprint. Hello. Remember, sprint intensity, sit. I'd never heard of this term before. I'd only heard of HIT. But this is now talked about by the American College of Sports Medicine. Stacy mentions it in her book a lot of times. Resistance training is really where it's at. And so if you're doing a couple of days of these more intense cardio, great. If on a Saturday, Sunday, you want to go on the green belt, have a cool ride with the family, have fun, but you shouldn't be doing sit and HIT, more than a couple times a week. Resistance training, usually for you guys, we're talking about 2 days a week of lifting heavy, not an hour and a half, 2 hours, 3, 4, or 5 times in the gym. That's how my patients get injured. And you just don't have enough time to recover when you do it that often. So what I'm wanting people to focus on is less of the zone 2, long, slow aerobic slogging stuff when they hear cardio. And when it comes to resistance, maybe 35 to 45 minutes a couple of times, 3 times max, lifting heavy. Lower reps. I was raised in the era of you do 3 sets of 10. This, whatever it is, 3 sets of 10. And we now know that if you want that neuromuscular adaptation, that increase in skeletal muscle mass and strength, you've got to do fewer reps with heavier weights. So 5x5s are my new mantra. You do 5 sets and 5 reps of heavier weight. And you can do heavier weight when you're only doing 5 reps. You don't have to go to fatigue. You don't have to go to exhaustion. We're not trying to make all of you bodybuilders either. And you're not going to get all bulked up and muscular because you're not going to be doing this at a intensity and frequency that's going to take you there like a bodybuilder. It's not my intention. And then the plyometrics is going to be these other things that you're doing. So if this is once or twice a week, and this is a couple times a week, what do you do the other, 3 days of the week? Well, it's plyometrics, or it's having fun. It's yoga. It's Pilates. It's doing things that develop your parasympathetic, lowering cortisol. It's the mindfulness practice. That's as much a part of exercise and recovery as not doing an effort that day. So it's not a day to not do anything. It's a day to focus on your mind, body. We live in a sympathetic fight or flight. And it kind of sucks because you guys, when you do things like intermittent fasting, it promotes a sympathetic fight or flight neurologic state for females. In men, parasympathetic. We go zen, we go vagal. Our cortisol goes down, yours goes up. So that's why a lot of times you'll have women come in saying, I am so pissed at him. He gave a half-assed attempt at this intermittent fasting for 6 weeks. and he had a 30-pound weight loss, and I gained 5 pounds. I hear this all day long, and it's because of the differences between men and women physiologically. And that's only one element. We're going to talk about other elements with intermittent fasting and keto, where men and women at different stages of their life are not all the same. Come to find out, y'all aren't just small men. You guys have your own unique physiology. This kind of gets into the benefits of the high intensity cardio. This is a little nerdy and a little geeky. It's a little down the rabbit hole. So I'm just, you guys, there's some really sophisticated patients in here that I've worked with. So I got to throw a little bit of this in there so you come back when I do these talks. So VEGF is vascular endothelial growth factor, is just one of many growth factors in the blood. This is one of the things that we're trying to manipulate, by the way, with macular degeneration and eye drops and antioxidants and things. But when you do HIT, it actually improves this growth hormone so that you get better cardiovascular blood flow. HIT increases nitric oxide. That's what you need to get from the second bullet point, which lowers blood pressure and pretty much makes you younger in general and prevents plaquing from beginning in your arteries. Nitric oxide is like everything good that can happen to your blood vessel is mediated through that for the most part. You're going to get better growth hormone response, which is good for shredding, as my guys like to say. They get rid of their belly fat and they get more muscle, like lean muscle. That's one of growth hormone's primary jobs. It helps to increase testosterone levels naturally. Everyone says, how do I increase T naturally? I don't want to take another pill. Well, HIT is one of the things that does that. It's not just resistance training. It's also the right kind of cardio. And more importantly, it counteracts cortisol, which I just told you guys. You have a little bit more of a tendency to live in that sympathetic nervous system response. And so anything that lowers cortisol in that way will help you. And having less cortisol helps with blood sugar, decreases depression, decreases inflammation, gut problems with microbiome diversity. It's also a strong stimulus to decrease both visceral, the hidden fat in our organs, as well as the stuff you can pinch that's over your washboard abs, the subcutaneous. So it gets rid of total body fat. So HIT's amazing for heart and body composition. Other benefits of HIT, as looking at compared to post versus premenopausal, there are estrogen receptors in the skeletal muscle. And in these skeletal muscle cells are mitochondria that make ATP and give you the power in your muscle. And we know that not only does estrogen, but also high intensity interval training can help regulate these estrogen receptors, this being ERA, estrogen receptor alpha activity. It improves blood flow, oxidative stress, increases cholesterol uptake. How do I naturally lower my LDL, doc? HIT. While you drop your cortisol, while you improve your testosterone, while you improve your brain, your bone. Is this starting to sound like a medication? If it were, it'd be $1 million drug in a day. Helps with antioxidants. Sprint intensity, that thing that you do where you go all out for 15, 30 seconds, it's not too shabby either. It's going to help you with preventing prediabetes, taking up that sugar that you've eaten into the cells in your muscles so it's not going to the liver and creating fatty liver disease, which is in 33% of the US population now. It's the number one cause of chronic liver disease, eating too many carbs. So sprint intensity is potential treatment for that. It increases basically enzymes that are involved with utilizing glucose, upregulates these enzymes that allow this GLUT4 thing that's sitting there. It's a little receptor that fuses to the cell wall and brings glucose into the cell. So just remember, when you do this intense cardio, it helps with bringing sugar into the cells so it's not stuck out in the bloodstream going and damaging nerves and causing general havoc. And again, increases lean mass, decreases fat. So both HIT and SIT benefit your body composition, what you're made of. So this is what I alluded to earlier. We've kind of gotten away from this intermittent fasting and women idea now because of this Low energy availability. It's actually it's a thing. It's a name. It's a noun. And it's when your exercise and output from the day exceeds what you're taking in. You got a net negative balance in energy. And when you have a net negative balance in energy from doing too much fasting, not getting enough protein, not fueling your exercise behavior, you end up getting things like stopping your periods. We know about that one. A lot of women that exercise more than they're eating, do too much ultras or triathlons, they stop ovulating and they lose bone. They get osteoporosis because of that. So there's endocrine dysfunctions associated with this LEA. There's metabolic disruptions that mess up their performance. They actually have a drop off in their endurance. They have increased injury. We see this a lot with people that are, getting kind of that bucket list. I'm going to go do a marathon at 40. I'm going to start CrossFit because my friends are all doing it. And they don't know how to fuel properly yet. So they start getting increased injuries with tendons, ligaments, and bones. They get stress fractures. They get osteoporosis. They have immune dysfunctions. The Tour de France guys, they have to be like sequestered because they've got this extreme amount of exercise for 3 weeks. Their immune systems are suppressed and they get sick at the drop of a hat. So if you don't get it, and it's impossible for them to regain the amount of calories they're expending all day out on the bike. They can't physically get enough in to avoid LEA. So they're more prone to injuries, getting infections. They get problems with impaired gut diversity. It changes their microbiome. They don't absorb their nutrients as well, and they get more problems psychologically. So this is a big list of things, not just about fueling as an athlete. It's about being a healthy person, getting enough energy in this day of fasting and restricted protocols and ketosis and carnivore, whatever have you. Benefits of plyometrics. We're going to talk a little bit about this since we've talked about benefits of HIIT, sit, and resistance. This is really the power training that's more elusive, that's hard to get at. This is the stuff that's training us for explosive power, speed. We know that it improves both the composition of our body and our muscle, also the strength of our muscle. It improves mitochondria. Again, improves taking glucose up into the cells, and it improves bone mineral density. So it's great for avoiding osteoporosis. Plyometrics, not something, that we all really learned in school. Okay, so what about supplementation in women and being active? Creatine. This is one of the two supplements I chose to focus on with the time constraints. This is something that men and women have. Women have a lot less of it. Bioavailability there's changes across your menstrual cycle and across the life of a female as to how much you can get access to. Supplementation is effective in both men and women. It's probably a little bit more effective for certain things in guys. We know that it's even more effective at certain times of the cycle when nutrient deficiencies are more rampant and protein and carb requirements are higher, which is in that last half of the cycle. So you don't want to be setting your time trial speed records on week 3, day 21, if you're premenopausal. You want to time your best performances if you can, and realizing sometimes that's out of your control for the first 2 weeks of your cycle. That's when you guys metabolically, all the ores are in the water. So what about creatine athletes and in women? We know that women have about 70-80% less stores than guys. They get about 20 to 40% less in their food intake compared to men. Loading protocols, they do increase total body mass and lean mass in both genders, more so in men. We know that supplementation does reduce some of the breakdown of protein, amino acids, post-exercise. It's more of a phenomenon in men than that it is in women. But it's these first two boxes that we're going to kind of focus on that we know happen. So what are some of the positive effects of creatine in women who are active? Well, it increases peak power. It increases strength. It increases your performance in anaerobic work when you're not just doing the aerobic long distance, slow and steady stuff, but when you're doing those weightlifting days, those hit and sit workouts, it improves your actual performance. It improves things like your ability to recover. It delays something called delayed onset muscle soreness, DOMS, which is a known diagnosis, and it helps your mitochondria work more efficiently so that in any given workload, your body's just working more efficiently. Your mitochondria are using oxygen more efficiently. So this stuff's working at the cellular level in women. It helps maintain strength during times where you're kind of off season, okay, without affecting percent body fat and your body weight. So when you're taking it easy and you're recovering, you're on vacation for 10 days in Europe, you're not doing your protein and your regular routine, continuing the creatine will actually help you maintain some of that strength that you just spent all that last 6 months gaining. I thought that one was kind of cool. I recommend people doing this as a maintenance between 3 to 5 grams per day as females. There's loading doses which are listed for you here, and this is more just for your reference. It'll be available on the slides. Depending on whether you're pre-meno or post-menopausal, we have different recommendations for how to load. There's a couple of different ways to do this. You can see that for short-term power, a half of a gram per kilo of body weight, and you divide that into 4 doses a day. You're doing that over 5 days. There are block training where you're doing something which is called periodization, where you're getting ready for something that you've been training for a long time. 4 doses, 5 grams a day for a week, and then backing off to 2 grams over a 4-week period. So these are things to kind of get you up and running. And then we maintain you at the 3 to 5 grams per day, and that can be continuous. Some women will and some guys will just do this on their heavy lift days. Some people will do this on their hit or sit days. A lot of people do it on all of those, so it's a minimum usually of 4 days a week if you're kind of following this protocol that I'm suggesting. Postmenopausal women specifically, it reduces the inflammation and oxidative stress, which can help with bone turnover and preventing osteoporosis. And that's with and without resistance training, weightlifting. It does this. If you're active with resistance training, you can also add to that it will help increase some of these growth factors that help with lean muscle mass. Again, with postmenopausal age group, you have a little different loading dose recommendations. It's roughly 20 grams a day still. You're doing this for about 7 days, and then you have a similar maintenance of 3 to 5 grams per day. And if you're doing it with resistance training, which is what I always recommend, you just get a whole lot more benefit. That first one's pretty good though. Less oxidative stress, less bone loss, not bad. The other supplement I wanted to give homage to was iron. Female athletes at all ages are much more likely to have iron deficiency even after they've stopped having periods. This was news to me, and this is something that I just kind of learned recently. There's a couple of hormones that regulate iron absorption and distribution in the body. One of them is this first one called hepcidin, and then the other one is erythroferrone. Basically, hepcidin's job is to maintain hormone. It's a regulatory hormone for iron absorption. It actually inhibits it being absorbed. It is upregulated post-exercise when you're inflamed, and often after exercise is a transient short period of inflammation. And women, depending on their age, can be vulnerable to having a relative inability to absorb iron after exercise. This has implications also for chronic inflammation, right? Autoimmune disease, rheumatoid disease, anything that's causing chronic inflammation can hurt your ability to actually absorb and distribute iron. And this is kind of cool. Things that down regulate this stuff are estrogen, testosterone, and vitamin D. All the things that we know help with limiting that problem getting iron in. So they help by suppressing this thing. You don't want too much of that hepcidin stuff around. Um, the other one, erythroferrone, it regulates iron supply for the red cell in particular, ergo the name, and it suppresses hepcidin. So, like estrogen, testosterone, and vitamin D3, erythroferrone is going to help you absorb more iron. I did not know that my sex steroids that I'm supposed to be an expert on were things that helped with iron absorption till a month or two ago. Crazy. Always learning. So vitamin D levels are important for bone and diabetes and cardiovascular risk and immune system and so many things. Now you can add to that growing list. It's important to have adequate vitamin D3. Most people in Idaho are low when we check them in order to adequately absorb iron from the food you eat. This is just something that's good for us to take home and know that premenopausally, this increase in this hormone hepcidin activity lasts about 3 to 6 hours after exercise. And postmenopausally, it can last for as long as a day. So postmenopausal women who exercise daily, there's a, a whole bunch of time where they've got this hepcidin stuff at high levels messing with their ability to absorb iron. This causes kind of a decrease in iron absorption and recycling from the gut itself when you've got these high levels of hepcidin hanging out. Iron deficiency is a big issue, and always ask your doctor to check ferritin and iron levels either pre or postmenopausal. Premenopausal women are at even higher risk because think about it, they're losing blood every month for 3 to 5 days. These are some of the things that put you at higher risk for having iron deficiency. We know that 15 to 35% of female athletes are deficient in iron. That's with or without anemia. So you don't have to be anemic to have low iron. Low iron, low ferritin, which is the storage form of iron, is often seen when you have problems with thyroid because you need iron to make T4, thyroid hormone. Come to find out, the risk increases if you have heavy or delayed bleeding when you're premenopausal. If you have low vitamin D at any age, if you have LEA, if you have a mismatch in the energy versus your output, that's another one of those dysfunctions. Endurance athletes, people who do long, slow endurance events are at highest risk, and it's because they're in a pro-oxidative, pro-inflammatory state for long, long periods of time. In perimenopause states, we know that perimenopause, right before your ovaries start to go on permanent strike, is a really inflammatory time for women. And so iron deficiency is an issue for them, even if they're not having irregular dysfunctional uterine bleeding that's super heavy. So just check it. It's easy to check. That's one of the reasons we check ferritin and iron and vitamin D3 annually on most of you guys. So we talked a little bit about food, fueling. We talked a little about the right kind of exercise. We've talked a little bit about supplements. I want to talk a little bit about the hormones themselves. So estrogen, so much more than just a sex hormone. Estrogen I want to have you guys start thinking about it differently. Think of estrogen working in your body like insulin, at least to some capacity. Estrogen, like insulin, is intimately involved with making sure the sugar that you eat from your food gets stuck into cells and metabolized and burned to make ATP, as opposed to having high sugar hanging around in the circulatory system, only to get shuffled to the liver where it becomes fat. That whole fatty liver thing we always talk about, 33% of the US population. It's because often as you go through the change and you lose your estrogen, now your glucose goes through the roof. So why at 55, 60 do my women come in and say, okay, yeah, I'm having some hot flashes, but that's no big deal. But I'm really ticked off that my cholesterol for the first time, not doing anything differently, is high. Well, the sugar's driving your LDL. My glucose, my doctor said I've got pre-diabetes. What's that? Is that a thing? Did he just make that up? Where is this coming from? It's coming a lot of times from the decline in estrogen that is working in the past for you, like insulin. And then you add the fact that you're losing growth hormone, which burns fat and protects your lean muscle mass at the same time. Yeah, you don't really have to do anything wrong to have things go south if you don't understand what's going on. So you guys as females, when you've got a plenty of estrogen around, you are much better than men at going aerobic, long, stamina. You guys are hardwired for that. So we don't need to spend as much time with the aerobic training with women as with guys. Guys are naturally built overall to be better at anaerobic, sprint, quick, short, all out stuff. And you guys have to work to get that and develop that. Guys, likewise, sometimes have to train more on the aerobic side. And it just has to do with how you're burning your energy and what energy source you're using. Are you using fats? Are you using glucose? Are you using oxygen to make that happen? Or is it anaerobic without oxygen, glycolysis? Cancer cells, by the way, like that latter form of metabolism. So we don't see that as the most healthy. In general, know that estrogen is just doing all this wonderful stuff at the cellular level, burning fat preferentially for you and sparing carbohydrates. And this is happening every month, and it's happening when you go through the change. We're going to see greater skeletal muscle mass with higher levels of estrogen. We're going to see more estrogen receptor protein expression when you've got this stuff around. Some of the myths: estrogen, like insulin, increases glucose into the cells. That is a truism. But a myth here is free testosterone levels. Everyone thinks I need more T to be strong. Free T is not associated with muscle strength in women. It is with men. That's not to say that having adequate testosterone doesn't help you with body composition and lean muscle mass. But when it comes to strength and looking at data, having higher levels of T doesn't make you a stronger woman. That was a big deal when I heard that. Like strength training, estrogen stimulates muscle mass and strength of contraction. That's really one of the take homes. That's a huge salient point. So some of the benefits of this resistance training that we've been talking about look a lot like the same list of benefits that estrogen does for women. In fact, the two lists overlap. Both resistance training and estrogen adequacy help you not lose your bone, improve speed and strength of contraction, improve vascular health, body composition, muscle strength and endurance, glucose control, joint stability, and brain health. They both do this. So in my world, I'm thinking, I don't want to have to choose between one or the other. I want to do both when it's safe to do both. Next slide is on some of the things that happen as we see decline. So as we lose this estrogen, testosterone, growth hormone, progesterone through our lives, and as we see changes even during our monthly cycle premenopausally, there's changes in body inflammation, sensitivity to the insulin that our pancreases are making. We have decreased ability to handle lipids and get rid of them, so our cholesterol goes up. As insulin resistance goes up, our LDL cholesterol and triglycerides often get out of whack. We have problems with losing bone. We have problems with cognition and mood disorders. And we have increased risk of heart attack and breast cancers, much of which has to do with these things going away, not because we're giving you synthetic, nasty, cancer-causing hormones. That's a whole nother discussion, which you guys have probably heard me talk about, the difference between bioidentical and synthetic hormones. So body composition and weight. Let's talk about peri to postmenopausal transition. The biggest change in fat versus muscle in y'all happens 3 to 4 years before you go through the change. Yeah, so perimenopausal, during that time of inflammation. during that time of sometimes irregular bleeding, estrogen dominance. These are the things that predominate that time of life. You have decreased insulin sensitivity. You have reduced ability to use fat as fuel over carbs. You can't flex fuel. We call it metabolic inflexibility. Like 93% of the US population is metabolically inflexible. They can't use ketones. They're totally reliant on glucose. And when they miss a meal, they're the first ones to let you know because they start crashing, burning. They don't have the ability to use butyrate and other ketones to sustain their ATP and their function. They get hangry and they are eaten by the clock, man, because they are metabolically inflexible. And this is largely in part to losing these hormones. As you do resistance training, it replaces and restores a lot of that mitochondria ability to say, okay, I don't have a lot of glucose around. It's been 6 hours since I ate. No problem. What do we got over here? That's flex fuel. That's metabolic flexibility. And most of us in the United States have lost the ability to do that, largely because of food and just being sedentary. And there's changes in obviously bone. There's reduction in your stimulus. It's called anabolic resistance. Normally, when you get adequate protein and a stimulus with resistance exercise, you develop more skeletal muscle mass. And as we get closer to menopause, we have less ability to do that. So it takes more. It takes lifting heavy stuff a couple days a week than it did when you were 25. It takes adequate protein, sometimes 15 to 19% more when you're postmenopausal. We heard that when you're in your luteal phase, you need more protein. Well, when you're postmenopausal and you lose growth hormone, you lose estrogen, testosterone's either here or there, guess what? You might need a little bit more anabolic resistance and a little bit more protein, not so much the marathons and the ultras, to maintain your health. And it talks about this estrogen dominance that can kind of creep in as you move towards a menopause. You guys have alterations in your gut microbiome, diversity, who's growing down there as you change your hormones. Reduce muscle mass, reduce quality of muscle, again, because estrogen, that's its job, right? And there's a decrease in net protein synthesis versus breaking down of proteins. So you have this kind of loss. There's also a skewing in the microbiome, the gut critters that are there, of obesity-associated critters. There's more of these firmicute families of strains of bacteria over Bacteroides. When we do the GI map stool test, one of the things we have is a ratio of firmicutes to Bacteroides. And if it's off, that's often the cause of persistent weight problems. People come in and say, I can't lose the weight. I've had the jab once a week, the Ozempic or whatever, and I'm just, I'm not able to get there, or I did it and I gained it all back. We've got to look at these kinds of things at the same time. And we know that there's increase in gut permeability, leaky gut, which is often associated with a lack of certain strains. We're talking about Akkermansia in particular, which is related to making butyrate, that ketone precursor we talked to, your short chain fatty acid earlier. So hormones are involved with who's there and whether you're going to be overweight or have high blood sugar or not. Who knew? It's not just hot flashes anymore. Oh my goodness. So weight gain during menopause, weight gain is triggered often by a reduction in the brain having this estrogen receptors to say, hey, you don't need to eat. Did you know estrogen is an appetite suppressant? One of the ways that we get chemotherapy patients who have no appetite to eat more is we give them a drug called Metabase, which basically is an anti-estrogen. So you want to have more appetite, get rid of your estrogen, go through menopause, right? So there's a progressive loss of protein, a progressive increase in appetite and blood sugar, cholesterol, and loss of bone, and increased risk for some of these things. So I've been saying this throughout the talk, but there's an increase in dietary protein need. You got to adjust your diet 16 to 19% more protein as you go through the change. I didn't know this as a family practitioner. You guys, this is new. We don't get this in residency. This is out there. It's now being studied Most of the stuff in sports were men. That's where all the data was. All the trials, the research was on males. It's more recent that we're getting some female specific, about time information on athleticism and females. So we're going to get into a little bit about the difference between fasting, time restricted, and I think that's getting close to the end. So the concept of intermittent fasting, fasting for 16 hours and crunching your eating to 2 meals a day over an 8-hour feeding window. I was really big into that just a few years ago. In fact, probably a year ago, I was still talking about that. Guys like Peter Attia, and as we started reading and learning more, Fast Like a Girl, the book that came out, we started realizing that there was more data that made it different for women than men. And now we know that, okay, here's the underlying premise. We were using it to promote weight loss, improve blood sugar, body composition. In reality, it promotes this low energy availability, low carbohydrate availability. So in active women, it was kind of backfiring and causing all these endocrine dysfunctions and performance problems. In men, they go vagal, they go parasympathetic with intermittent fasting. You all go fight or flight. So there's a major problem because that's related to cortisol and belly fat and blood pressure and blood sugar going up. There's no improvement in glucose control in most women that do intermittent fasting. Boom. That's not something I'd known, but this is what a lot of the sports medicine data is showing. The autophagy, which is kind of replacing out old worn out cell parts that we talk about, some of the benefits of prolonged fasting in men and women, it's minimal to non-existent in women with intermittent fasting. Not fair. Here's the kicker. Often it causes increases in visceral fat, the white fat, the inflammatory fat in women over men. So yeah, this was news to me. So instead of intermittent fasting, we're focusing on time restricted eating, meaning that we're going after cell adaptive responses by optimizing hormones, by doing resistance training, fueling for that exercise, not under fueling and restricting. And restricting your eating times to, man, eat breakfast, get that going. That's the most important. But don't eat after dinner. Try not to snack. Try to be nothing in the mouth calorically, for 3 hours since dinner when you go to bed, ideally. So TRE is something we are shooting for. Intermittent fasting, not so much. Now, there are a few women that intermittent fasting can work for, and that's why we call this personalized medicine. As a whole, my experience long-term has not been positive the last 10 years treating you all. Guys, it's another topic. I use it sparingly as well. What about ketogenic diets? Now, this is talking about population of women that are peri and postmenopausal without exercise. What does ketogenic diet do? Well, the pros are, these are non-exercisers. It can reduce weight, improve insulin sensitivity. That means avoid prediabetes. And it can reduce some of the craving, the food noise, going for carbs. The downside is ketogenic diets have been shown to increase cardiovascular risk, decrease bone density, largely because of the increase in animal fat, arachidonic acid, omega-6s that promotes a lower pH, which makes you rob calcium from the bone to buffer that, and you lose bone mass in the process. So eating too much animal products that are high in arachidonic acid, omega-6s, can backfire on you. It reduces microbiome diversity. That's probably one of the worst problems with doing keto or any kind of long-term elimination diet for that matter. And this was the kicker. Ketogenic diets in women that don't exercise decreases lean muscle mass. Wow. Why would anyone do that long-term? In women that are exercising, little different scenario. Same thing, ketogenic diet. It's found to suppress the adrenal or the thyroid gland. We know that when you're doing intermittent fasting in women, it also can suppress thyroid function, raises reverse T3, which is the brake pedal of your thyroid. It increases cortisol, the opposite of what we want, increases fat, visceral and total body fat, as well as lean muscle mass. There's loss, and it decreases microbiome diversity. These are big problems for me. because these are all the things I'm actually trying to counteract. So ketogenic diets in women, whether you're sedentary or working out, I'm not a fan anymore, even for short term. So what do we eat? Well, you eat a whole foods diet, plants, nuts, seeds, veggies, lean meats, whole grains, legumes if you don't have sensitivity to lectins, minimizing full fat dairy. Not a fan of full fat dairy. That's where all the toxins are. That's where all the growth factors are that stimulate prostate and breast cancer. Why would I tell you to eat that part of the dairy product that's got those things concentrated? That's a controversial topic. That's my opinion. Avoiding simple sugar, minimizing excessive alcohol, processed foods. What's it look like specifically? Well, carbs, you're going to get most of the complex carbs from your plants, your low glycemic fruits and things like that. You're looking at a baseline of around 3 to 4 grams per kilo a day. If you're a light exerciser or sedentary, okay. We talked about getting something more than that if you're active. Protein, 30 to 35 grams of protein per meal. If you're going to do a stack, somewhere around 15 grams, aiming to achieve 1.8 to 2.3 grams per kilo per day of ideal body weight. After exercise, you want to try to get a 30, 40 gram branched chain amino acid protein food in there. We're going to show you some of those here tonight, the ones that we recommend. Fats, not as big of a deal. We get it from a variety of sources. I like omegas. I like the omega-9s, the avocado, the nuts, the seeds, and the omegas from marine sources. Fats should make up somewhere between 20 to 30% of your total daily energy. So if your basal metabolic rate is 1600 and you're trying to lose weight, you don't want to eat below that number because you'll go into that LEA state really easily. That's not even taking into account your exertion and losses from exercise. Your basal metabolic rate is what it costs energetically just to keep the lights on. When we eat below that minimum, our brain starts to lock down the fat, and good luck losing weight. The body just got the message there's a famine and it ain't going to happen. So when you hear me say things like you're under eating, that's why you can't lose weight. This is where all this is coming from. So that's carbs, proteins, fats. What about peptides in these injections? There's all these different names. We use them here, but we use them in the context of working one-on-one with a dietitian to develop a nutrition plan that makes sense, and a resistance exercise, a HIIT and a sit cardio program, and we have fantastic results. Unlike the statistics now show that after people stop the injection, they actually get 85% of them gain the weight back. So ethically, I can't prescribe these GLP-1 shots anymore, knowing that, unless they're willing to do these packages with us where they're doing the holistic approach. We have wonderful results all day long. I don't think I could ethically sleep at night writing a prescription knowing that in 6 months when they stop putting it in once a week, 85% of you are going to gain your weight back. That's wrong. That's not medicine to me. So what are the big rocks as a summary here? We're done. It's about, in women in particular, getting great sleep, restorative sleep, so that your cortisol is not all screwed up. Your circadian rhythms are not all messed up, because it's not only associated with cancers, it's associated with obesity and glucose dysregulation and mood problems and energy problems. Activating your parasympathetics. That's what Lois, our health coach, is all about. She's our cortisol queen, we call her. She manages or modulates y'all's cortisol that's off the chart. So dealing with the mind body is number one for a reason. It's my number one saboteur for resistant weight loss. Too much cortisol messes up gut microbiomes, your absorption, messes up bone. We call it kryptonite to testosterone and to estrogen, because when your body's stressed out, it's not thinking about reproduction, making babies or having periods or keeping muscle mass around. Protein's important. Timing is everything. Having it around your activities. Same thing with carbohydrates, the right amount in fueling pre and post exercise. Limiting excessive alcohol doesn't have really any place in a healthy person's regimen, in my opinion. There's just no upside anymore. Strength training, oh my gosh, if you haven't heard yet, we need to rewatch the slides. And then cardiovascular and doing the right kind. So that is what I had tonight. There's some case studies, but I want to give you guys chance to ask questions. The scenarios in the case studies really just talk about taking folks that are not recovering adequately in their exercise protocols. They're overtraining, and on their work days when they're working, making sure that even though they're not exercising, they're still getting adequate meals. When they do work out, that they're not doing a hard cardio day the same day they're doing a heavy lift day. Those things kind of make intuitive sense. Adding in yoga and stimulating mind body parasympathetic, taking days off, 1, 2, 3 days off a week. When we used to race bikes, we used to say that if you didn't take time to recover correctly, you trained to mediocrity, meaning you never got beyond a certain level of performance. The guys that went really hard 1 or 2 days a week and were good at recovering, they're the ones that were on the podium. They would get to new levels of performance. So recovery, 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 but doing the right form of cardio and strength training, along with knowing and understanding what's happening with your bodies month to month. And as you go through the change in life with hormones, is where it's at.